Good evening. I'm John Bailey. This is People to Be Heard, the program where people who have something to say have their say. Tonight, you've got, on my immediate left, Debbie Warburton, Director of Government Relations for the Alzheimer's Association of Hudson Valley, and Michelle Brisbane, on my far left, a volunteer for the Alzheimer's Association, and a person whose family has experienced the heartbreak of Alzheimer's personally. They are here because June, when we're taping this program, is the Alzheimer's Awareness Month. And I became aware of facts I did not know about Alzheimer's at a recent talk given at the Bridge Deck, and decided that the public should know more about how to recognize this alarming threat facing the nation over the next decade. First of all, thank you, ladies, for coming on the program.
Sure, no
and
problem.
Debbie, let's start with you. What is the scope of Alzheimer's disease across the country?
Well, John, first I want to say thank you for having us on and allowing us to draw attention to this problem that's not very well known. Currently, 5.4 million people in our country have a diagnosis of Alzheimer's, including two-thirds of those are women. And
I didn't know that.
yeah, and if nothing is done, it's on the rise. And if nothing is done, it's anticipated that by 2050, that number is going to rise to 16 million people. So it is certainly on the rise. Unless something is done to stop it. And we can talk a little bit more about efforts that are being made to stop that trajectory.
Absolutely. Now, Michelle, you have experience with persons in your family who suffer from Alzheimer's. What are the symptoms, and how did your family become aware of this terrible disease?
Well, some of the symptoms are when they start losing, they're not sure what's going on with their life. Like, for instance, they can't remember. They can't remember if they had an item, and they go back and look for it, and they go around circles trying to find the item. Mm-hmm. It's very difficult to see a loved one go through Alzheimer's. It's very, very difficult. The Edwards family has experienced it cold-hearted. Mm-hmm. In other words, it's a horrible disease.
Right. Could you talk about the personal involvement in the family and the effort that it takes to handle a person and guide them through this?
Okay,
as good as possible.
I was a caretaker for my mother.
Oh, I see.
She passed away a year and a half ago, and again, with the Edwards family, we have went through a lot. Her father had Alzheimer's, which his wife was his caretaker. My mother has two sisters, one who was a year older than her. She passed away with Alzheimer's. She has another sister who's living with it now, and it takes so much on the loved ones. I have 3 children, and if it wasn't for my 3 children and myself, I don't know how I would have been able to make it with my mother. Yeah. Because it starts off as a disease that she can't remember things, but then it gets really, really worse. It gets to the point that you can't even get her in the bathtub. You can't get her to eat. You got to force her to eat. You got to force her to wash herself. She just don't know what life is about.
Right.
I think if I could add something to that, people think that Alzheimer's is just kind of a harmless disease, people telling the same story over and over again, forgetting where they put their keys, but really, as it progresses, it affects everything that you use your brain for. And by the end, you've forgotten how to use common implements. You've forgotten how to swallow. You've forgotten that you need to eat, things like that. So it is really serious, and it is a fatal disease.
How fast does this progress?
Normally, the progression is between 8 to 12 years. There are some people who go through it a little bit quicker. The early onset Alzheimer's folks tend to progress a little quicker, and it's something to do with being in a young, healthy body. I've personally known of cases where people have been 20 years from diagnosis to death. So, but the average is 8 to 12 years.
And any idea, any average of how long the person suffering from the disease is completely almost incapacitated, as you described.
Well, I think it
Is that
depends on how you
average?
define incapacitated.
Yeah.
I think in the later stages can go on for a couple of years. It depends on a lot of factors. It depends on what kind of care they're getting. Usually, a person with Alzheimer's, or many times a person with Alzheimer's, will pass away from something else before the disease runs its course, like heart disease, stroke, something like that will be the actual cause of death. But Alzheimer's definitely is a complicating factor.
Yeah. What should you do if you or the people you know think you might have someone who has Alzheimer's?
Well, I would say if a person is noticing that something wrong about their own cognitive abilities, or someone, if you're noticing about someone you love has more trouble, I would take steps to get a definitive diagnosis. I'd start with your primary care physician, perhaps be referred to a neurologist or a gerontologist. There's a full evaluation that can be done. What you want to do is rule out other things that may be causing similar symptoms, such as medication interactions or hormone imbalances that can be addressed. So.
Was this your experience in your family? That you suddenly noticed they were doing this? Where did you go when you thought something might be wrong?
Well, with my mother,
Yeah.
I took her to her primary doctor, and I mentioned to the primary doctor that I see things doesn't seem right. But again, I had experienced it already with my grandfather.
Yes,
so I had knew some of the symptoms by looking at my grandfather. And her sister, who was a year older than her, seen the symptoms with my aunt and seeing what my cousins was going through with my aunt. So I basically had a idea what to look for with my mom.
So is this disease genetic, as
There
Michelle's experience has been?
There is a genetic component. Certainly having a first-degree relative with the disease puts a person at increased risk for developing it, but there are other cases where no one in the family has it and it just suddenly crops up. There's a small percentage of cases where there is it's in their DNA that there are families that everybody develops Alzheimer's, but those are really a small fraction of a percentage. So, the prevalence can be inherited, but that, once again, that doesn't mean that the person is going to develop Alzheimer's. There's just so much we don't know about this disease.
Right. So, are there facilities that provide 24-hour care for people with Alzheimer's disease and memory issues?
There are home health agencies, there are adult day centers, there are residential facilities that specialize in Alzheimer's care. And so I would encourage people to kind of explore all of their options for taking care of their loved one.
How many are in the county, Westchester County?
Boy, I'd have to get back to you on that, John.
Okay.
But people that are interested can definitely call our 800 number.
Right.
And our helpline specialist will be glad to spend some time on the phone with them, talking about their specific situation and what kind of make a plan for what's going to be best for them in their circumstances.
Now, there are some. This being Alzheimer's Awareness Month. You're coming up with the longest day, which is an annual
Yes.
extravaganza that focuses. So tell us about it. It's coming up the 20th of June.
Well, I'm glad you used the word extravaganza because what we are doing on the longest day, it's June 20th. It's the day of the year with the most hours of daylight. If you remember your 8th grade science, it's the summer solstice, and so for 16 hours on June 20th, we're going to have people all over the country engaging in their favorite activities. To honor a person that they love or the person that they know that has Alzheimer's disease. And it is really a celebration of the effort that is put into caregiving by people like Michelle and other caregivers for whom every day seems like the longest day when you're dealing with Alzheimer's. So that's kind of the genesis of the whole longest day. But we're encouraging people, and once again, they can find details about this on our website, www.alz.org. But we encourage everybody to join in and raise awareness and raise funds. And so altogether, we can make an effort to end this disease. That's really our mission, is to end Alzheimer's.
Now let's see. What are the funds used for? You fund research. In fact, I think you're the third largest
Yeah.
fundraising
We're very proud of that.
organization
We're the third largest
for
funder of Alzheimer's research.
Yes.
We're right behind the National Institutes of Health and the government of China. So,
That's
some trivia.
Alzheimer's is huge in China?
Well, Alzheimer's, you know, with their large population, and they have an aging
That's where they have the
population.
most, right?
Yes, and they have large aging populations similar to other countries, including the United States, so that would make sense. But yeah, the government, our government is really upping their investment in Alzheimer's research. We're very proud of that. When I started with the association about 5 years ago, they were spending less than $500,000 on Alzheimer's research, which is just a drop in the bucket to what was being spent in other areas. Now, this year, the government is, the National Institutes of Health is going to be funding Alzheimer's research to the tune of $991 million. But we're still only halfway to where the scientists say that we need to be in order to find a cure. Scientists say we need to be spending $2 billion a year to find a cure by 2025. So we're not done yet. We're still going down to Washington to.
What are the prognosis for a cure?
I think a lot of really promising things are happening in research. I think we're on the cusp of so many things. But as you know, research takes a long time. Research, you know, you have to follow a lot of leads that may not turn into anything. You know, that's all a part of research. So research has to go on. I have some relatives that are researchers, and they say that what the general public doesn't understand is that you can't just turn the research off and on. You have to continue doing things so you can build on your previous research. So it has to be consistent.
Absolutely. Now, you volunteer, Michelle,
Yes.
for Alzheimer's.
Yes.
And tell me, what do you do as a volunteer?
What do I do?
Yes, what do you do?
Okay, I go solicitate different companies into trying to help finance towards the research with Alzheimer's. Actually, I'm going to be sitting outside of Sam's Club on July 9th with my table, with the Alzheimer tables, to register people to participate in the walk for September 25th at White Plains High School. I have a little candy corner on my desk, or it's just a medical center that people come in and purchase their little items. So that help goes towards whatever I could do to help financially towards
Yes, because,
Alzheimer's.
for you, it's personal.
It's very personal.
Yes. And tell me about how the walk raises funds. I've never quite understood that.
Okay, again, we solicitate different big, well, anybody. We solicitate you. We'll solicitate you.
No,
We just ask
no
for
donation is too small.
no donation.
Or too large.
Exactly. And we just ask for a donation towards it, and you know, we try to let people see that we're not just taking the money. We even offer you a T-shirt or whatever we have to give to you. But it's very important.
And how much does it cost to join the walk? Or do you give
It doesn't
whatever
cost
amount?
anything,
It doesn't,
actually,
no.
To sign up.
To sign up for the walk, to join the walk, to
And,
participate in the walk.
yeah.
It doesn't cost anything. But we do ask for a $100 donation, and we provide you with a T-shirt.
Okay.
So,
right.
or to raise funds, you know, in the amount of $100, you can get the T-shirt.
Right.
And I want to say that you know, we've talked a lot about research, and that's great. But the funds that we raise with the walk and other fundraisers also go for services and supports for people that are in Michelle's situation. You know, that caring for a loved one with Alzheimer's. We have support groups, we have educational programs, we have retreats, we have just a range of services and supports that people can find out once again if they call the helpline.
Yeah. Has the recent movie Still Alice made a big impact?
Yes, I would say that's really raised a lot of people's awareness about the disease.
Did mine.
Seeing you know, someone who is as lovely as, you know, Julianne Moore, playing a character, she's not the kind of face that people expect when they hear Alzheimer's. So that really raised awareness of young onset Alzheimer's in particular.
And this can strike anyone.
Yes.
That's
We say if you
the
have a
insidious
brain, you're at
part.
risk for Alzheimer's.
Exactly.
right. And it's so easy to say, well, I'm just getting old, but it's not really a disease of the old.
No.
No.
There's a definite difference between what they call age-related memory loss and Alzheimer's disease.
Yes, we have a slide on that.
Yeah, good.
I think we showed, there we are. And if you want to, you can see that I have some of those on the right, but then on the other, I have some of those on the left.
I will say that
How do you tell the difference?
I would say that whenever we do a program on the 10 warning signs, you can see people in the audience mentally ticking them off one by one and saying, okay, I have that. What you need to focus on is this different for the person? I mean, some people throughout their lives are bad with remembering names. I'm bad with remembering names. So if I don't remember the names of people I've just met, that's probably not Alzheimer's. If I forget the name of my sister, who I love and talk to regularly, that would be a warning sign. So it's changes that seem abnormal for the person.
It's changes. So we go to a doctor, and what does he check you for?
He will
or she.
he or she will do a full workup of blood work, do an MRI of the brain, talk about medications. They really do like a holistic assessment, and they rule out a lot of other things. You know, as I said, like it might be a hormone imbalance, it might be a medication interaction. So many people are taking different medications, and a lot of times they don't know that, you know, the medication interaction could cause symptoms of dementia and Alzheimer's.
Right. So let's see. Your physicians were pretty sure because there was a history in your family of it.
Right.
So is there any record nationally of people whose families have a history of this that they could be identified? That just popped into my head. Sorry.
There's a record of the small number of families where there's a genetic component, where, as I was talking before, there are families where every single person develops Alzheimer's if they live long enough. So there is a record of those families, but there's not a record of every family who's ever been affected by Alzheimer's. So there probably wouldn't be, you know, Michelle's family is not on that record because she hasn't had the genetic component.
Yes, that is interesting. There's not a registry.
No.
Or a family tree type situation.
No. Not yet, but, you know.
Not yet. Well, it shows you how, would you say little attention has been paid to this until you started, your organization was founded in the, I think, late 90s?
No, it's like more like the early 80s.
Early 80s.
Yeah, I think the early 80s. Yeah, and even up until, I would say, the last 10 years, I think there's not been a lot of awareness about Alzheimer's because there's a stigma attached. People with Alzheimer's don't want to talk about it. People that, you know, their father or mother or husband or wife is acting in a strange way, they don't want to draw attention to it, so they don't talk about it. And also people think, you know, as I said, they just think, oh, it's, you know, it's grandpa just getting old and people forget things. And so we really have struggled to have it recognized as a disease instead of just something that happens as you get old.
Why should people who haven't been touched by Alzheimer's get involved in efforts to raise awareness of the disease?
Because, as I said, everyone that has a brain is at risk to develop the disease. And, you know, if you don't want to think about that, think about this, that we are actually, in this country, we're paying $236 million a year to care for people with Alzheimer's disease through, you know, this is out-of-pocket expenses, this is Medicare and Medicaid spending, this is our tax dollars at work. 1 in every 5 Medicare dollars goes to pay for the care of someone with Alzheimer's. By mid-century, this is going to be 1 in 3 Medicare dollars. Medicaid spending is 19 times higher for a person with Alzheimer's as it is for a person with without Alzheimer's. And so just in simple dollars and cents, and I know that we in this country are so concerned about economic stability and where our dollars are going. One big way that people can really have an effect on government spending and our economy is to find a cure for Alzheimer's. So.
Well, and look how long it really did take to get AIDS somewhat under control, which is really frightening, and that we knew what caused it.
Yes.
We knew what the virus was, and they still, you know, they're still perfecting a what I call them a life extender now.
Yes.
But
AIDS is a good example, though, because look how our country jumped on board with that, and we said, okay, this is unacceptable. We have to find something to control this disease, and we did it. And we can do the same with Alzheimer's. I fully believe that.
Now, the interesting thing going forward that the Alzheimer's organization is doing, how are you getting the government to pay more attention to this?
Well, every year, the Alzheimer's Association has an advocacy forum in Washington, D.C. So if people want to save that date for 2017, it's March 27th through 29th, 2017. We'll be down in D.C., going to Capitol Hill, meeting with every one of our legislators to keep them aware that Alzheimer's funding needs to increase. Here in New York State, we have every year a rally day in Albany where Alzheimer's advocates from all over our state converge in Albany, and once again we meet with our legislators there to talk about what we need to do here in New York State. We're really proud to say, I have to put in a plug for New York State, New York State devotes $25 million a year to Alzheimer's dementia care and services, and we are the state with the highest spending in that regard. So we can be proud of that.
Well, New York is always number one.
It is number one.
No, it really is. I mean, people may complain about New York, and there may be a lot of things wrong with it, but there's a lot of things right about
yes,
it. Yes,
and New York has traditionally been a leader in a lot of programs in that respect, a lot of health, a lot of social programs.
Okay. Now, Michelle, drawing on your personal experience, what do you feel should be the awareness level of persons watching people in their family, and what should they look for? Because you had the past history.
I have, and looking forward into the Alzheimer's, I think everyone, first of all, it's growing tremendously. It's growing at a younger age. You know, I know people who's getting the disease now at the age of 50, and I am 54. I'm not afraid to tell my age. I'm 54, and I have even mentioned to my doctor to test me because I am worried and I'm concerned because we have the history in my family. So when I go to the doctor, she goes, "Oh, Michelle, you're okay. You have a job that makes your brain work, so you're okay." But still, I'm concerned. And I think people should be aware that you don't have to be 80 years old to get this disease. You could be in your 50s, and it could start hitting you in your 50s. So it's a main concern that, you know, if you're feeling yourself starting to slide and you're feeling, you should be concerned. Don't sit up there and say, well, okay, I have Alzheimer's, because I tell the family members, my family members, you know, just be concerned and watch yourself and, you know, allow others to watch you and just be concerned of what they say to you. Because leading down the line, it can be a problem.
Right, and it does. There's no way to really slow the disease down.
There is no way.
Its own pace.
Alzheimer's is the 6th leading cause of death in this country. It's the only one of the top 10 with no way to cure it, no way to treat it, and no way to slow it down. So there's a sobering statistic for you.
Okay, well, let's see. We have a few minutes left to go, and now you have the podium. What would you like to say to folks out there?
I would like to say that, and just in hearing Michelle talk about volunteers, there are many ways to volunteer for the Alzheimer's Association. I think if your viewers have been affected by what they've heard, they should definitely reach out if they feel that they want to volunteer for the association. We have office volunteers. We have people that come and help us the day of the walk. We have people doing longest day fundraisers. We have a lot of ways that people can get involved. We have people that go down to Washington with us and to Albany with us. There is nothing that affects a legislator more than hearing a personal story just told from the heart. I can be there telling them about facts and figures, but I guarantee you all that goes out the window when they hear a caregiver like Michelle talking about how it really affects them in a personal way. That's what they remember. So I'm always looking for volunteers to become advocates to go with me to visit legislators. So there's a lot of things that people can do to volunteer, and if they want to get involved, I suggest that they just call us up and
right, and that
and
number
get involved.
that we showed on the slide, directs you right to the Hudson Valley.
Yes,
Right,
the
so
toll-free
they can-
number, 800-272-3900. During business hours, will direct you to our local offices. In evenings and on weekends and on holidays, it directs you to the National Call Center, and we will follow up on our next business
And they'll
day.
also send you this brochure,
Yep.
and
Know the 10 signs.
signs.
no,
Yeah.
that's it.
Yep.
Wrong
They'll send you
brochure.
this brochure.
Right, and
Know the
which
10
shows
signs.
you
I don't know which way to
the
put it,
warning
but-
signs.
Yes.
Tells you a little bit about it. And the website also has an enormous amount of materials
Yes.
amplifying what we've showed you briefly in the slides here.
There are, for people that are on the internet, there's a lot of information right on our website that you can just get at any time any time of the day or night, you can access that.
Right, now, let's see, I'd like to turn to you for
Yes.
a personal coda to the show.
Okay. Personally, I basically told my life story. Right now, I'm a volunteer. I volunteer in 3 different states. I volunteer, I help Alzheimer's work. I have nieces who help me in Durham, North Carolina. We do the work down in Durham, North Carolina. We also go to Washington, D.C., and we're letting everyone know how important this is because Alzheimer's, I think people are sleeping on it and not realizing how increasingly it's increasing more and more every day. And people don't know the awareness of Alzheimer's.
Growing faster than
It's
AIDS,
growing
isn't it?
very, very fast.
I don't know what the comparison is, but I would say it's growing very fast.
Yes,
Yeah.
right. And again, from a personal standpoint, it really takes a toll.
It does.
On persons caring.
It
for.
does. It does. Again, if it wasn't for my 3 children helping me out with my mom, I don't know what I would have did.
There are whole studies that are done about the effect on caregivers of taking care of a person with Alzheimer's. Their own health care costs rise significantly just because of the stress
hadn't
of
even
dealing
thought
with
of
it.
that.
Yeah.
Yes.
But now that you mention it, it's very true. Well, Debbie Warburton, the Director of Government Relations for
yeah.
Alzheimer's in Hudson Valley, and Michelle.
Brisbane.
Michelle Brisbane. I'm sorry.
That's okay.
That's the second time I've done that in 2 shows.
We're so friendly, we're on a first name basis, so you just forgot our last names, right?
Absolutely. So this is John Bailey saying good night for people to be heard.